everyone, the chapter that we are going to today is role of the government in health. In any country, government plays a very important role. So, today we will focus what is the role of the government when it comes to the health. Health is something that everybody is worried about, especially with the past 2 years that we have spent with this endemic, which was earlier called as pandemic, the COVID situation. We understand that health is wealth. Moving on, what all we are going to cover in today's chapter is the basic introduction, which I have already begun. What is health? Healthcare in India. Public and private healthcare services, because there are two sectors that deal with the health services. Then we will just discuss them individually, first the public, then the private one. Then healthcare and equality. As I told you in my previous sessions also, civics is all about creating equality. That is why with every topic, we would relate that how we can create equality, and if it doesn't exist, then what are the reasons? What can be done? And then there are two case studies, the Kerala experience as the Costa Rican approach. So let's begin. As usual, we'd always focus on India. The biggest quality of India is that it is a democratic country. And in a democratic country, what do we expect? We expect the government to work for the welfare of the people. Yes, that is why we choose the representatives who are going to work for us. This could be through the provision of education, health, employment, housing, or development of roads, electricity. There could be anything that bothers the people who live in that particular country. And that is why it is the job of the government, properly called as the representatives, to whom we have selected, to ensure that all these basic facilities are provided to each and every person, each and every citizen living in that country. Let us understand about health and in what ways it is related to the work of government. First, we have discussed that India as a democratic country, what is the role of the government? Now, there are few pictures here on the screen. You see that there is an old lady and she is cooking food, but there is no proper kitchen. Then, if you see that there is a malnourished boy, a picture that shows the health services being provided. This picture shows that there is no proper drinking water that is being supplied, and that is why people have to gather at a particular place or at a particular time to collect the water, and so on. Before we begin this chapter, we will understand what is health, right? Before we just move on with the further discussions, because this chapter talks about the role of the government in health. By now, after discussing so many chapters, we know that what is a government and what are its function. Exactly, the term government stands for what? Health. Health means our ability to remain free of illness. What kind of illness? It could be anything. You know, even a normal pain, it could be a headache or just a normal cold and cough or a sore throat, hampers our productivity, hampers our performance. And that's the reason it is very important to be in good health. Other than diseases, there are various other factors that affect our health. What do you mean? If I say that I am not keeping well, everybody will feel that today ma'am must be having fever or headache or body ache or stomach ache, whatever. Not being in a good health does not every time mean that I am suffering from some or the other ailment, but there are many other things that affect that. One is clean drinking water and the other one is nutritious food. What is health? We'll continue with this topic. So finally, we have concluded that it means the overall development of an individual. That means the person should be active in all the spheres of life, whether I am going to play sports, whether I am going to have dinner with my friends, whether I am going to school to teach, whether I am coming here to record the lessons, whatever I am doing. Everywhere I should be very active, I should be really happy. And there should be no mental stress, because my performance is affected when I am really suffering from any sort of mental pressure. Now we'll focus about the health facilities in India. First thing is, why do we need health facilities? Everybody is aware that we should keep our health as our priority. And for that particular reason, we need some health centers Like, if you want to stiff it, if you want to be in shape, if you want to look good, what do? You go to gym. So for that purpose, there are gyms. Similarly, if you want to have good health, where will you go? To the healthcare centers. Now there should be healthcare centers like hospitals. Then if you want to detect any particular type of disease which you are suffering from, you need laboratories where you can go and get yourself tested. If there is an emergency and you do not have any vehicle to commute, in that case you need ambulance services, and at times we need blood banks also. Apart from all these things, what else we need is health workers, qualified health workers instead, doctors, nurses and trained professionals who are going to diagnose that disease. Diagnose means first to find out that what is that disease from which the person is suffering from, and once that is detected, they should be in a position to start with the treatment. So when I say that I need proper people, trained professionals to take care of anybody's health, along with their expertise, I also need some of the medical equipments, the image of which is shown on the screen, and apart from these there are many. Now we'll quickly have a look at the following data. This table is also given in your book, but whatever is there in red is what I want to discuss with you, that approximately more than 30,000 doctors are qualified every year. Then we have healthcare facilities which have grown, like in 1950 there were only 2,717 government hospitals. In 1991 there are 11,174, and in 2017 there are 23,583 government hospitals. That means with certain duration there are government hospitals which are increasing in number. Then India gets, every year there are few people who are coming to India to get the treatment, to whom we refer as medical tourists. And why are they coming to India? Because it is believed that India has few hospitals which are best in the world for some particular ailments. India is the third largest producer of medicines in the world. Wow, that's an amazing thing. But if I just go and discuss on the next slide, then it says that most of the doctors, they settle in the urban areas. Nobody wants to settle in rural areas, and the reason is very well aware, because we have discussed about the things of rural and urban areas in our previous sessions. Only 5 lakh people die from tuberculosis every year. That's a huge number, and almost 2 million cases of malaria were reported on this particular year when this case study was done. We are not able to provide clean drinking water to everybody, and most of the diseases are waterborne diseases, and half of the children in India are undernourished. The meaning of undernourished is that they don't get proper food to eat. Now what do you understand from both the columns? So there were 2 columns, the right column and the left column. So what have you understood from these 2 columns? Like, there are some positive developments which are happening, but still we are not able to provide the proper healthcare facilities. Our country has money. Yes, India has money. There are several millionaires and billionaires that are from India. We have the knowledge. Indians are knowledgeable, and that you can see if you just have a look at all the prime positions in almost all the top offices which are held by the Indians. And people over here, they have experience also, but still there are no necessary healthcare facilities available. That is a big question and something we should ponder on. Now we'll just discuss a case study. Quickly we'll go through the cost of a cure. Then this is a conversation between 2 boys. Hi Aman, good to see you back. How have you been? So this is a conversation that started between 2 friends. Then once they meet, he asked that, how are you? I had viral fever and I just went to the hospital. Oh, me too. I got back to school on Monday. My daddy took me to see to the doctor in the new hospital which is on Kingsway, and it was very exciting. The building looked so posh. I thought it was a 5-star hotel. Daddy said that it was so because it's a private hospital with the best of facilities. Daddy had to pay ₹500 at the reception counter itself before we even met the doctor. The doctor asked for many tests, but everyone was so friendly. The lady who took my blood sample for testing, she cracked the jokes with me, so I even forgot my pain. After the test results came, we back to the doctor, we looked through them, the doctor just see all the test reports, and then when he said that everything was fine, I only had viral fever, and then he prescribed some medicines. And the boy said, "Thank you doctor, I am already feeling better." Now we will move on to the perception of a different boy. You see, I have been dying to tell you all about it. So now the first boy says, "I was so excited, I couldn't hold myself, and I was so excited to share all these things with you. But what about you? Which hospital did you go?" Because this is a conversation between two friends and both of them were not feeling well. Once we will just read the conversation, you will understand the difference in their status also and the kind of the services that they have received while they both were suffering from the same problem. It wasn't as nice that it was yours at all. At first, Abba didn't want me to take because he said that it would take too much time because his father was busy, and it really did. Now the boy says, otherwise also father was thinking that it's going to take us long if you go to the hospital, and indeed it was a very time consuming process. We went to a big government hospital. There was a long queue which was waiting at the OPD counter, and I was feeling so sick that for the entire duration I was almost leaning on Abba. When our turn came, the doctor examined me and asked for a blood test. Then we had to go in and stand in another long queue for the blood test to be done. We got the test results, and after the first situation, the boy got the test results then and there only, immediately. But here in this situation, the boy got the test result after 3 days. There was a different doctor that day. Now he says, the day I went, there was a different doctor, and after third day when I went with my reports, there was another doctor. The doctor says, "Show me his OPD card and test results quickly please." My hospital was nice, but they gave me many medicines and the cost of whole thing was quite a lot, and the other boy says that, "Oh, my treatment did not cost much." What have you understood from this story is there were two boys suffering from same diseases. One went to a hospital that looked like a 5-star hotel with ultra prime facilities, and the other boy went to a government hospital, and rest of the differences you can analyze while I was discussing this story with you. The next story or the next case study which we are going to discuss is story of Hakeem Sheikh. What happened with this man? Now let's understand. This man Hakeem Sheikh was a member of Paschim Banga Khet Mazdoor Samiti. To this we will refer as PBKMS in our future conversations. What is Paschim Banga Khet Mazdoor Samiti? It is an organization of agricultural labourers in West Bengal. This man Hakeem Sheikh, he met with an accident in 1992 and he suffered some head injuries. He was admitted in government hospital, but they refused to take him, they refused to admit him because they do not have a spare bed. Look at the situation. Head is one of the most important organ of our body. If head stops working, everything stops working. And I pity this man because he had severe head injuries, and look at this condition that they did not have a bed to admit him. Another hospital did not have the facility or the specialized doctors which were necessary for the treatment of Hakeem Sheikh. So this way he was rejected from 2 government hospitals. He spent 14 hours in a critical state and was taken to 8 different hospitals, but then no one admitted him. Strange. A man bleeding in a very critical condition and is being referred from one hospital to another hospital. Life has a cost. Finally, he was admitted in a private hospital. Private hospital, obviously he will get the treatment with no doubts. But private hospital means lots of money that you have to spend if you really want to get fit and fine. He was angry with the behavior of the people that he saw, he faced in all the government hospitals. Hakeem Sheikh and Paschim Banga Khet Mazdoor Samiti filed a case in the court. Why? This conversation I have left over here only. I am moving on to something else and we'll get back to this. Now my question to you is that why do we pay taxes to the government? Do you know that you pay taxes? And if you don't, today after just watching this entire session, Sit with your father, your mother and ask them that do we pay taxes? Why do we pay taxes? How much taxes do we pay? And you will understand that after toiling hard day and night, your father and your mother are paying the taxes for each and every services that the government is providing. Then I have few more questions why he filed a case in the court. Again, we will consider this story of Hakeem Sheikh. We will pay the taxes or we pay the taxes to the government so that the government can use the tax for what? The welfare of the public and for the defense, for the infrastructure, for health, everything. Whatever services the government is providing is not by the government. Basically, the financial support is from the citizens and it is just the services that are coming from the government. It is you who is paying for these services. So, you have all the rights to avail these services. Because citizens cannot organize these services for themselves, that is why what do? We pay taxes to the government. Now, you are paying, I am paying and like you and me, several other crores of citizens are paying these taxes. Government collects this money at one place and in return they are providing us or they should provide us with hospitals, dispensaries, school, clean water, good road lights and everything. With the help of these taxes, some development programs are funded. What kind of developmental programs? Like education, healthcare, employment, social welfare. This we have already discussed with you. The tax money is sometimes also utilized for the relief work and the rehabilitation work during emergency. Now, what kind of emergencies? It could be like drought or flood or earthquake or even during some wars.
To watch the complete video, download the Upbind educational app from Play Store and App Store.